right now I'm the circulator, okay? This is not sterile at this point. This is on another table somewhere in the OR. So as a rep then, you're gonna watch them, you say, and it's all wrapped up in the blue, right? This is my tray that we're gonna use today. It might be 2 or 3 trays and they'll be labeled and numbered kind of thing. And so go ahead and open up the top tray here, okay? So, all right, great. So they unwrap it, right? And then they take the lid off the tray. Sometimes they'll hand it to you or they'll put it down under the table somewhere. They'll put the lid somewhere and then they'll, or no, that's broken too. Sometimes they'll just, actually they'll bring it over to the scrub tech then, and the scrub tech will take it so that it's still sterile. And like so, they'll bring it over on the blue, right? And the scrub tech will take it off the top, bring it over to their table, take off the lid and hand it off, okay? So let's see. Circulator, oh, and then the circulator, of course, these days they look in the blue drape you've probably seen, and they're looking for any holes, anything where something might have poked through or worn through, because then your whole case stops and you're done until it gets sterilized and rescheduled. So now the scrub tech has the tray on the table. Here's your job where you're going to explain what they're going to use, right? So first of all, you might use K-wires. In this case, then, you'll be pulling out this tray. This is the tray where your K-wires and drill bits are. You can open up this tray by lifting this side where it says lift. All right, and then it has a little cover that holds them all in. So now you can see all of your drill bits and K-wires, and they're labeled right here. So in this case, we're gonna go ahead and take out our 2.7 drill bit and our 2.0 drill bit. All right, and so we're gonna put those out on the table. We're gonna take out like an olive wire or something, which this tray doesn't have, so we'll take out olive wire and set that out. And then we're gonna go ahead and take out your, and I haven't even looked at this tray, so take out your drill guide. This is a 2.7, 2.0 drill guide, all right? Now, at that point in time, what's gonna get used first, you guys? 2.7 or 2.0? We're gonna do a compression screw, lag screw first.
2.7.
Over drill first, right? So over drill through the near cortex. So I'll have them take the 2.0 drill bit and stick it in the drill guide. That way they won't forget about that later, right? Now, what they might also do is right here, they'll take that drill bit, load it up on their power and the drill guide. That's all set, okay? So you've got that ready. Next thing they're gonna do, they're gonna drill, right, with the other one on the other side, the 2.0 drill bit on the 2.0 side with the drill guide. So they drill all the way through, then you're gonna grab the screw. Here's your screw trays. And this one, you know, they're just gonna take out of the tray however they can manage to do that and open it up. They're not gonna take any screws out, of course, but they'll lay that part of the tray out, right? This they'll either hand off or they'll set under it, kind of a thing. So you got your screws, you have the screw forceps, and you have drivers for the screws that are in the same tray. So you can ask them to go ahead and take out a driver. The driver handle, just because we're on that step, is over here. You can use this silver handle and go ahead and load it up. And now you've got your driver ready, okay? So you got your screws. You're going to use a 2.7 screw, you'll tell them, right? Tell them where the measuring guide is. So in this case, it's over here. And sometimes you push the head up against like a backstop, and sometimes you'll push a head down towards what I would call a neck, right? So sometimes there's a end of the tray like this, and you have to push the screw back all the way in order to get a proper measurement. Other times you push it all the way down until it fits up into the, like I just call it a neck of the screw down into the tray. So in this case, this screw measures 20, and it says 24. So make sure they always measure, right? So you have your plate tray. You'll tell them what we're probably going to use is a 4 or 6 hole 1/3 tubular plate. So they go ahead and take their plates out, and they might take out plates or they might leave them just in the tray. But you know, if you really know that the doctor's going to use a 1/3 tubular plate, then go ahead and tell them. Then what they can do, you know, after taking a couple of them out, they might take out an extra 1 or 2. If it's possible, they might use a T plate. You'd say that. And then they can take this part right here, right, set it back in this tray, because this tray is going to get kind of covered a little bit with some other things. Okay, so you got your plate, you got drill bits, you have your drill guide. You of course are going to have to measure, right, for your screws for the length. In this case, this depth gauge has a protective sheath on it, or a protective cover, so you got to unscrew that. Tell the scrub tech that. You can just set that aside back in the tray. So here's your depth gauge, and sometimes SPD will take these apart. So you have to know how to put them back together again, right? And explain that to a scrub tech, because that's what you get them like. Oh boy. And then you have to explain this part and this part to the scrub tech to get your depth gauge. So that comes before screwing, right? The plate is going to come before all of this, right? So that's how you might have it set up. Now you have bending irons in the tray. We would just kind of make a note of that with the scrub tech. Just let him know in case he needs to bend these plates. There's bending irons in the tray. They're right next to the driver handles here that look like wood. They're called phenolic handles. And then there's additional instruments, and this I would not even take out, because in these cases they have their own general instruments, but in this tray, weird how it opens up, lift and pull out, and you have all these extra instruments underneath the tray. So you have wire cutters, you have pliers, some forceps, and should be tenaculum in there, but it's not in there, so that you can, for bone holding forceps, that kind of thing. They will know, and they'll have all of their own instrumentation for the approach, all their retractors. You know, when you're running through the surgery inside, you might say things like, you know, the surgeon makes an incision right over the MTP joint, a longitudinal incision about 2 centimeters long, whatever it is, 2.5 centimeters, and avoiding neurovascular structures and retracting those aside, he'll get down to the bone. That's all we care about as far as like the surgical technique, as far as the approach goes, okay? Once we get down to the bone, then, you know, you talk about your cup and cone reamers, which we don't have, so we'll skip that step. And then basically, I will just, I'm gonna stick this back somewhere where there we go, it won't get lost. Then I will just take a plate and like lay it over, and so we'll go through the steps as far as like the surgeon goes then. So you talk about what the scrub tech is going to hand to the surgeon at certain points in the case. Just go step by step through the surgery, okay? Once we are done with the second screw, then you say, now the surgeon will close, you know, tissue in layers, and close the skin. I'm going to say, dress the wound. There we go. Make sure, you know, the surgeon will dress the wound, and then we pull off the drapes, and the patient gets wheeled out of the room. But at that point in time, that's when I want to hear what you're going to say, you know, to excuse yourself at the end of the case, okay? Something, yeah, whatever comes to your mind. All right? Any questions though? No? Is that thorough enough?